Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. We are excited to have a return guest, one of our favorites, Dr. Pooja Singhal, who is a gastroenterologist and president and founder of Oklahoma Gastro Health and Wellness Center. Dr. Singhal, welcome. So great to see you again.
Thank you, Jackie. I'm thrilled to be back. And thanks for doing these and continuing patient education sessions. I think your voice is so impactful. So I'm so thrilled to be here.
Oh, you're so welcome. And thank you. You know, it's always great to discuss these topics. And this is a good one today. You know, we've gotten some really great activity on our podcast platform, especially YouTube, for EoE. And it's amazing to see the engagement and the questions. And one of the questions that came up was, a hot dog sent me to the ER. Do I have EoE or eosinophilic esophagitis? So we're going to dive into this and kind of make some sense and give people the information they need to make good healthcare choices in partnership with their provider.
Absolutely. I'm just smiling because, you know, it's such a common thing that we are seeing. This question is so timely because I feel like this is happening more and more with food getting stuck. And as we go into the football season, I think this is going to become more and more relevant.
And it's not just hot dogs. We just use hot dogs because it's a common thing that does get stuck in people's throats and children too. So let's begin. First of all, I ate a hot dog and I can't swallow it and I go to the ER. What happens? Like, how do I know whether the food that is stuck in my throat is related to EoE or not?
Absolutely. That's a great place to start. First of all, at any time when you're feeling like the food is getting stuck and you're feeling chest discomfort or feeling like gagging or feeling like you can't breathe, you know, it's very important to stop eating, to try to get help if you really feel like you're gasping for air. Of course, oftentimes nearby people can do a Heimlich procedure to help relieve if that's an acute situation. If it's not an acute situation, you're starting to notice, hey, I'm having difficulty with certain solid foods, like whether it's meat, like hot dog or breads, and you feel like you're needing to drink a lot of liquid to get it down. Talk to your primary care physician about these symptoms. That's really important to get further care. Now, if you're in a setting where you just is like, okay, this is not going down, it's definitely stuck, and I'm really, really concerned, my first and foremost advice is do not wait. Go to the ER, tell them what's going on. And the next steps would be to contact usually ER physician or provider is going to evaluate you. They may get imaging if it seems appropriate. And most likely they will call the fellow gastroenterologist, the GI doctor, to come and help with disimpacting it. And the way we do that is we take a small camera, we give you medication that make you relax and sleep. And once you're relaxed and asleep, we take a camera with a thin tube, which is a very sophisticated camera, and we take it down your esophagus to look at what's causing the reason that led to food getting stuck. And then we try to push the food down gently, or we retrieve it, break down the food and retrieve those particles and further evaluate.
So during the ER visit, is EoE diagnosed, or is that when a referral would be made for a follow-up?
Yeah, so that's a great question. So of course, every different system has a different protocol depending upon who is on call. But ideally, what would happen is the food would be removed. And during that examination, we can definitely tell, is it a stricture? A stricture means narrowing and scar tissue in the esophagus that needs to be stretched out. Or is it something which is now becoming more and more common, is like eosinophilic esophagitis, the disease entity called eosinophilic esophagitis. And ideally, we would take tissue samples at that point and send it for testing and arrange for a follow-up. And that is something important for everybody to know so that they can ask for that. Because if this happens one time, there's a chance that you would have food getting stuck again and again unless we treat the underlying problem.
I'm glad you said going
Yeah.
again and again and again. I had a really good friend of mine who every time, I think I mentioned this on earlier podcasts, every time she would go and eat certain foods like a kebab, like a chicken kebab or a beef kebab, she would get food stuck. And she said she'd been dealing with this for years and she'd visited the ER and she never went and got any kind of follow-up with the GI doctor. And it wasn't until her 40s that she was finally diagnosed with EoE. So I want to ask this, how common is this? And she would adjust her behaviors. She would try to regurgitate the food herself.
Absolutely.
And it was alarming hearing all of that.
Absolutely. And I'm so glad that you brought that up. I actually just scoped a patient today who also is a friend who mentioned this to me. Actually, we both had our sons. We were meeting for a swimming class, our boys' swimming class. And she was like, Pooja, I really need to come see you because I have had this trouble with swallowing for ages. And this is just a common thing in my family. So they just said, take a Prilosec over the counter and it will be fine. And she is in her 40s. So it's funny you mentioned the exact same scenario. And I talked to her more just chatting. And I was like, I really think you can have eosinophilic esophagitis. And sure enough, I scoped her today and she had all the signs for eosinophilic esophagitis. So I took biopsies. So to answer your question, eosinophilic esophagitis is a relatively new disease entity. And by that, I mean that it's only 20, 30 years old in the medical world. And within last 10 years, we have learned so much more about the diagnosis. We've had revolutionary treatment options now available for eosinophilic esophagitis. So we are learning more and more, and it's becoming more common to diagnose it. But it's still, there's a lot of unknowns. Like a lot of people still don't understand EoE. They don't know about it. So the diagnosis is definitely delayed. The more common thing is, you may just have GERD, which means gastroesophageal reflux disease, or, just, adapt the behavior and it will be fine. So there is a real need. My biggest advice would be if you are having trouble with swallowing, do not wait on it. It's not just reflux. We are seeing eosinophilic esophagitis diagnosis more and more prevalent in United States and globally, but definitely in United States.
I'm glad you mentioned that because I think especially women and maybe all patients, people, we think, it's just something that happened. I was eating too fast, or it's something, I'm stressed and something's not going down right, or it went down the wrong pipe. But you mentioned your friend. It sounds like everyone in her family or many people in her family had the same thing. Is there a genetic component to this?
Yes, we do believe that there is a genetic component, that there is an increased likelihood. We just don't have the direct association. So a lot of times, patients who have had family members diagnosed with eosinophilic esophagitis that are at slightly increased risk. Also, another important thing is other autoimmune diseases could also be associated. But most importantly, if people have had nasal polyps in the nose, allergic rhinitis, so seasonal allergies or runny nose, they tend to have that, or asthma. Asthma is a big one. Those three, the allergies, allergic rhinitis, asthma, and then atopic dermatitis. So as kids or as adults having like skin rashes called atopic dermatitis, if you have that, any of those three or multiple two of those three conditions, you're at more of a risk for having eosinophilic esophagitis. And so if you're having swallowing problems and have any of those conditions, you definitely should be asking for this and getting evaluated early. But anyone in general, if they're having persistently difficulty swallowing, I would recommend that they talk to their primary care provider, get an appropriate referral for gastroenterology.
No, that's great advice because it's no fun and it's scary, and we don't want people to start avoiding food and doing those behaviors that we've addressed in other podcast episodes. And we'll make note of that in the description so people can check out where we go more into depth about what EoE is and the various treatment options. But I want to stay on this important point. We talk about the allergies, and isn't there an inflammatory aspect to this? We've heard about type 2 inflammation. What is that, and how does that impact the disease?
Yeah, absolutely. So type 2, there are two different types. Our bodies are just so amazing, and they have different immune pathways to fight off infections, fight off allergies. But sometimes, so there's type 1 inflammations, there type 1 inflammation pathway, type 2 inflammation pathway. And sometimes when it's auto triggered, when there is like an autoimmune component, it can just cause excessive activation of that and produce eosinophils. Eosinophils are a type of cells that are present in the body normally and definitely present in increased amounts if we have some sort of allergies. But in eosinophilic esophagitis, that pathway has increased activity because it's kind of auto-activated because of that type 2 inflammation. And when you have that increased deposition of eosinophils in the esophagus, it leads to swelling in the esophagus, it leads to stricturing, narrowing, it can lead to long-term complications of untreated inflammation in the esophagus. So it's very, very important to detect it early. And the great news is it's treatable. And now we have very good medications that treat it with great evidence base and great results. So,
No, this is great information, and we can't iterate enough that trouble swallowing is not normal, and you shouldn't have to live your life adjusting and making accommodations for eating because things are getting stuck in your throat. And, a referral to a gastroenterologist could put your mind at ease, or your loved one's mind at ease, and know that there's help out there. And the other thing, you've mentioned this in our previous episodes, another question we get a lot is there a cure? And we talk about EoE as a progressive disease. And this is another reason why we encourage the seeking out of care sooner rather than later. Can you explain what that means by EoE being a progressive disease and why there's no cure?
EoE is a progressive disease, which means that if it is left untreated, and I kind of alluded to this earlier, there is this constant inflammation in the esophagus by deposition of eosinophils causing swelling, inflammation, stricturing, narrowing. What it means by progressive disease is if it's left untreated, it can cause further narrowing that can lead to fibrostenotic strictures, like scarred down strictures. It can lead to lots of swelling and inflammatory strictures. And over time, it can delay motility of the esophagus. What that means is esophagus squeezes to get the food down into the stomach. That's the motility. And esophageal muscles are amazing. Like they're squeezing in a very synchronized way. Well, if you have strictures, if you have narrowing, if you create these blockages and swelling, the motility then, instead of doing this synchronized, beautiful motility peristaltic wave, it's just gonna be delayed. And the motility delay is tough because there's not that many options of treatment for that. So early diagnosis, early treatment to get into remission of this disease really keeps this disease treatable, and we can treat it. But it's not one and done type of thing. It's not something that, we can give antibiotics for 2 weeks and then we never have to think about it. It is a progressive disease. So you take medication, you feel better, and if you stop taking medication, it can recur. So it's important to identify, treat it long-term, and be compliant with it.
No, those are great points. Now, we heard, we started the episode with food getting stuck. Now, if you're, you have children or your husband or your wife or someone you're taking care of or a loved one, like a friend who you notice is having trouble with the food getting stuck, that's one sign. What are some other behaviors or accommodations that are symptoms? And it's not just, we talk about eating slow and other things that maybe raise a red flag for someone to be like, hey, this isn't normal behavior. Maybe we should go and get this checked out. Like, what are some of the other symptoms that people should be on the lookout for in order to maybe realize it's time to seek some health care?
So some of the behaviors that people don't even realize that they're doing it, but that could suggest adaptive behaviors, is eating slowly. So somebody who's taking 30 minutes, 1 hour to eat a very small portion of meal could signify that they're really chewing, they're really kind of adapting and drinking a lot of water. That's number one. Number two is having any kind of difficulty with large pills, like avoiding pills or cutting pills to be able to swallow it, modifying food in any way, tendency to do more pureed food, gravitating more towards smoothies. And this, again, is like chronic behaviors. Other thing would be drinking lots of liquids after small bite, those kind of things. And food is such a important part of our culture that, you can usually pick that up. And food avoidance, just in general, ordering less amount of food and just avoiding it, or for fear of embarrassment because it takes them too long, or they may choke. I've had a lot of patients be like, I am so scared to go out and eat with my friends because I may choke, and I don't want to have that embarrassing event. So those are some of the adaptive behaviors that you may want to look at, or be cognizant of your loved one, to kind of be like, hey, I think you may need to go checked out. Pressing on your chest is another one, feeling like burning sensation or kind of repetitive swallowing more.
And what about for children? There are some differences. You may think your child is a picky eater. And what would raise the red flags for a parent or caretaker of a child that may have EoE?
Excellent question. That's very different, actually, than adult behavior. So children may present with kind of tummy ache, failure to thrive, meaning they're not eating their food. They're just having complete food avoidance and not gaining weight. Like I said, nausea, tummy ache is a big one. Those are kind of the more presenting symptoms with the children. If they're not gaining weight properly, they're having tummy ache with food, they're having nausea. Of course, reflux is always going to be one of the symptoms with eosinophilic esophagitis. But really, in the children population, in the pediatric population, it's food avoidance, limitation of food, having struggle with food, and not gaining appropriate weight.
Would food get stuck often? Would they have trouble swallowing as well, children?
They can, but it's not as common as it is common of a presentation as with adult.
No, thank
you.
They
can, but it's not as common.
How common is it in the ER for people to present with food impaction like that?
So it's actually very, very common. Now we are seeing, food impaction patients being diagnosed with EoE as the culprit lesion very commonly. So, and I think that speaks to the fact that people just have had this adaptive behavior, or kind of have just thought, oh, it's just reflux, or oh, it's just stress, and you just kind of avoid it till it's that bad that you're not able to swallow it. So the food is just stuck.
Now, we know from research that, before we get into the treatment options, we know from research that there are foods that could trigger EoE symptoms. So Are there common food triggers that EoE patients should be aware of?
The big six foods, we call it kind of the 6-food elimination diet. The 6 most common foods associated with eosinophilic esophagitis and can be trigger are milk, eggs, nuts, soy, fish, wheat. And when I say fish, I'm talking also about shellfish. So those are the 6.
And it's
most common ones.
Yeah. And it's now, can an elimination diet help in managing EoE? And does it mean that if they just avoid these foods that they're not going to have EoE? And I think what I'm getting at is I want to get into the treatment options and what patients can, what their choices are and how they could manage this disease.
Yeah, so that's a great question. Of course, so with EoE, you can have environmental allergens as triggers. You can have food allergens as trigger. And if you're able to really identify, hey, my food triggers are milk and nuts, and as long as I avoid this, I'm okay. I think that's possibly a good treatment strategy, but that should be done under the care and supervision of a physician and a specialist. Because again, with this disease, you want to prove that clinically you're in remission, meaning you're not having symptoms, and also at a tissue level, that you're not having high levels of eosinophils. And that's really, really important because, again, we talked about it being a progressive disease. So you don't want to be like, okay, I'm safe, I'm not having those serious symptoms, but underlying you really having low levels of inflammation that can lead to long-term complications. So the treatment options, again, it would include identifying food allergens and proving that those are the right food allergens if that's the way you want to go, and being on the right medications. And the medication options in the world of eosinophilic esophagitis includes what are called proton pump inhibitor medications like pantoprazole or meprazole. You have viscous budesonide, which is again anti-inflammatory. So those were kind of traditional models in medication. Proton pump inhibitors, viscous budesonide, or food elimination diet. But most recently, we do have a very revolutionary treatment, which is targeting the therapy, that type 2 inflammation pathway, to very down to the science, exactly where they can target that receptor and block the receptor. And that medication is dupilumab or Dupixent. And you take it once a week and you have targeted inflammatory pathway blocking that will turn off this autoinflammation pathway where we have had very good results. And it's a long-term, once-a-week medication that's an injectable. So we are seeing very, very good and promising results with that too. So that's now kind of leading the care in eosinophilic esophagitis in the medical pathway.
And there's been so much progress in the last several years. It's amazing to see the research, our understanding, the clinical presentation, and also the treatment options, which, because it's a progressive disease, if left untreated, it can be very detrimental. I mean, you showed us a slide, a picture of, I'll never forget this, it stayed in my mind, of a man, I forget how old he was, but his esophagus was so small that a pea got stuck in it.
Yes, exactly. It was kind of mind blowing. And he was only like 31 years old. And I remember talking to his wife and I was like, how is this his first time coming? How is he swallowing food? And she's like, well, he suffered from this since he was a child, and it takes him an hour and a half to finish his foods. And I was like, why didn't you guys seek care? And she's just like, well, that's just the way he was raised, this is just, part of life. Like, it was expected. And I still was so humbled by that. I'll never forget that. So it's really, really important to not ignore that and not be embarrassed by if that's what's happening. Please, I encourage you to talk to your primary care provider and really ask for some answers and ask for, hey, can I see a specialist if you're not responding to initial treatment plan? Because we now have better understanding about eosinophilic esophagitis and better treatment options. Great treatment.
This is so encouraging, and I'm glad we did this episode. It's not normal for things to get stuck in your throat, whether it's a hot dog or a piece of meat or bread or anything. That is not normal. You need to seek care. And if it brings you to the ER, you can expect to hopefully get a referral to a gastroenterologist if the gastroenterologist wasn't on call to do your initial getting that out of your throat. But I also want to highlight the new treatment options that you mentioned. And just as we close up this episode, what is the long-term outlook for someone with EoE? And again, stressing that it's not just taking a pill or eliminating foods. There's an ongoing relationship with your healthcare provider to look at what's going on in your esophagus, taking those biopsies, because you may be feeling good and you may be able to eat better, but there could be things going on that we don't know unless we look at it. So can you just sum up that and why that's so important as we manage our condition for the rest of our lives?
Absolutely. With any long-term condition, it's very important to have good follow-up, and especially important to have good follow-up when you are feeling good, just to then kind of address, hey, this is what me being good looks like, both clinically and confirming it at a tissue level. Hey, our eosinophils are down. They're negligible. We don't even see it at tissue level. This is what our goal is. So then we are mindful of any early signs of the medication not working or the disease kind of acting up again or being in a flare-up. So because it's a chronic condition, the follow-up is very, very important. A lot of my eosinophilic esophagitis, once we get into remission at a good place, they just need to see me once a year. And we check in, make sure there are no side effects, making sure there are no other concerns with their swallowing and esophagus to keep them healthy, and prevention is that then becomes the goal. And the outlook of this disease is very, very good. I mean, we have some great medication options now and a better understanding, and we continue to learn so much about this disease that the outlook is truly very, very good. So all this information to say that there is a lot of hope when it comes to difficulty swallowing and swallowing problems, and in the world of eosinophilic esophagitis, that there's a lot we can do, and follow early detection, treatment, and follow-up are the key to keeping this disease in check. And swallowing is such a food, and being able to swallow and enjoy it, it's such a part of our culture, a global culture, that nobody, in my opinion, should suffer with this.
You are absolutely right. And we're going to continue bringing this information, this evidence-based information to our listeners because it's so important. Don't forget to subscribe, and share this episode with your friends and family. Dr. Singhal, thank you so much again for being on the show. We can't thank you enough. And remember, you're not alone, patients out there. We're here for you. Reach out to us with questions, suggestions or more questions that you want us to address on upcoming episodes. We're here for you, and thank you so much.
Thank you, Jackie, and share your success stories too.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.